Greeting to all the Physio TV viewers. I am Dr. Barkha Nathani, final year postgraduate from Sancheti Institute for Orthopaedics and Rehabilitation, College of Physiotherapy, Pune. So today I will be talking about the novel approach, which is Flexibar. So what is Flexibar? Flexibar is a technique in which we use the active vibration techniques to activate the core muscles. And this core muscles for which we have the Flexibar, it is defined as a fiberglass rod with a hand gripping in the center, which is reinforced by the two weights. So that weights are made up of non-elastic, non-toxic natural rubber. And with this, there are the vibrations causing it. What are that vibrations? That vibrations are the movements where recurrent changes of the positions are occurring at equal intervals of time with and low amplitude. Okay. So Flexibar training is a method of using vibrations to activate the core muscles. The shaking action of this Flexibar creates an vibrations that passes throughout the body, destabilizing the body and forcing the stabilizing muscles of the core to be activated. So why to train the core muscles? See, for that, every single movement you make begins with the core. Core is where your body's COG is located and it is where your movement begins. A boxer's knockout punch is generated from the strong and resilient core and not from his strong biceps. Strong core will stabilize the pelvis, which in turn stabilizes your hip, knee, and ankle. While stabilizing the pelvis, you need a strong core, which also stabilizes lumbar, thoracic, and cervical spine, and which in turn stabilizes your shoulder, elbow, and wrist. Okay. So for technique of the shaking the Flexibar. So Flexibar, for that you need to hold it with the center grip. Okay, with one hand or two hands. And the Flexibar can be held with the fingertips or the palm of your hands. Flexibar cannot be too tight in the holding part. It cannot be too tight or not too loose. Otherwise, it can quickly fatigue your forearms. Standing with the shoulders back and down, stabilizing the abdominals and lower pelvic region by holding them with the foam. Likewise, you will instruct the patient to tuck in your tummy and retract and repress the shoulders, like maintaining the whole of the kinetic chain, whole of the kinetic control. And then initially you will have to swing the Flexibar once to get it started. Always begin a small swinging motion in order to get a perfect rhythm. Okay. So shaking direction. As a general rule, the Flexibar is always shaken in the direction that the arms are pointing. So when the Flexibar is parallel to the ground, and the arms are extended down towards the floor, the Flexibar movement, the Flexibar swinging, the Flexibar oscillations should move down and up. Whereas with the arms extending forwards, the Flexibar movement should be out and in. With the Flexibar in the vertical position, it moves from either from the side to side or forward and back. Also, we have to check that wrist is straight and elbows pointing to the ends of the Flexibar. And also, this does not supply when the Flexibar is held vertically. This the direction is for the Flexibar in the horizontal. Okay. So Flexibar gripping positions. So gripping positions, semi-closed double hand low position, semi-closed double hand chest position, double hand open cradle grip, semi-closed double hand overhead position. So this all gives the greater control over the shaking the Flexibar ka direction. And even we have the other as single hand open fingertip grip, fingers which we have the slightly spread. This will activate more of the core. This will focus more on the core of the muscles. And double hand underhand, it is mostly used for your activation for the biceps and also the rotator cuff muscles. And also you have the double hand underhand. So we have also got the training recommendations, which will be 10 to 20 minutes for 3 to 4 times per week. The swing of this Flexibar, it will be for 30 seconds to 1 minute. And we will have a break, that is the rest interval. It will be from 60 seconds to 90 seconds. And then we can continue. And do not swing the Flexibar too continuously, as you can have the fatigue also. So the advantages, this improves the posture, muscular strength and endurance, improves metabolic waste removal, improves metabolism, improves balance, improves sensoromotor coordination, and also you have the fast and effective results. So how it will improve the posture? Swinging motion will activate your deep involuntary muscles of back, strengthening and toning them will improve your postural mechanisms. Okay. And then improves muscular control, muscular strength and endurance. So how it will improve your muscular strength and endurance? Weakness of the muscles leads to poor blood supply, and which also leads to muscular imbalance and pain. And with this, Flexibar improves the strength not only to your core but also to your also the most targeted muscles. Like for example, if you have to target your rotator cuff muscles, that are the sits, supraspinatus, infraspinatus, teres minor, subscapularis. So for rotator cuff muscles, you can also go with the technique like tuck in your tummy, uh, grips with the firm grip, which will be not too tight, not too loose, and maintaining whole of your kinetic control, retracting it and depressing it. Then activating your whole of the shoulder muscles, only the RC muscles. So yes, and metabolic waste removal. More oxygen to the muscles will facilitate the metabolic better waste removal, and less acute muscle soreness, which will give you the recovery time will be shorter. Okay. So then improves metabolism. Positive effect on metabolism because high number of active muscle fibers will be used. These muscle fibers commonly lay stagnant in conventional exercise routines. Why? Metabolism improval will also lead to a better activity, better coordination, better proprioceptive feedback, then improves balance. So for balance, small vibrations, coupled vibration with any movement creates an unstable environment. With this unstable environment for the body, we will have the forcing couples, forcing that muscles to recruit and keep the steady environment throughout your exercises. Then improves your sensoromotor coordination. Sensoromotor coordination due to firing of your constant firing of your nerve impulses, which are improved during small isotonic contractions of muscles, which lead to your better reaction time. When this vibration stimulus is applied to your muscles with creating the oscillations, it creates a strong proprioceptive stimulation, which significantly affects your movement perception. Whole body vibration are necessary to provide a strong sensory stimulation that activates your muscle spindle and strengthen the proprioceptive senses, thereby strengthening muscles that are essential for your postural mechanisms, for the toning of your muscles, and also for the strengthening. Then fast and effective results. It gives us we have to train them the 3 sets of 30 seconds and then rest interval of 60 to 90 seconds. So it gives the fast and effective results and the shorter interval also. So indications. Indications, we can go with the osteoporosis, overweight or obesity, arthritis, shoulder injuries, disc, back or vertebral problems, shoulder and neck pain, weak pelvic floor muscles, postnatal clients, Parkinson's disease. Even we have some articles which says that Flexibar using it in the obese patients, the overweight patients. And the EMG studies have also proven that Flexibar is effective with the other strengthening protocols, with the other exercises, it is effective in using the technique. Contraindications, it will be for acute back pain, recent operations, infections or swelling, cardiovascular disorders, acute rheumatic arthritis, numbness or loss of feeling in the extremities, hypermobile vertebral joints, and pregnancy in the third trimester. It is said that in first and second trimester, we can go with the Flexibar training, but the rest interval should be more for the females. For the pregnant females, the rest interval should be more. So these are some of the techniques in which they have activated their core also, and also the shoulder girdle, the thoracic spine, serratus anterior. For every of the targeted muscles, we can activate the core, and also for this training, they have told about the positioning and also the swinging motion, the swinging direction, which will be in and out, upward or backward, or right or left. So for that, they have also told about the body positionings and the swinging motion. So likewise, here also in this, the fourth one in which you can see they have activated the core muscles with the feet wide apart, and then the swinging direction. The swinging direction is in and out, that is forward and backwards. Okay. So the swinging direction, it is not just necessary that your swinging should be fast, or your swinging should be too slow for that. Your swinging direction should be always in that the green signal, in this green part, and not towards the red part, because this will affect the flexible also, and the effectiveness of this treatment will be hampered. So this was the part. Thank you, everyone. I would also like to thank Dr. Parag Sancheti, Chairman of Sancheti Group, and Mrs. Manisha Sangvi ma'am, Chairperson, Sancheti Healthcare Academy, for their constant guidance and support. Our principal, Dr. Apurva Shimpi sir, for giving me this opportunity, and our technical team, and also our Physio TV viewers. Thank you. See you next time.